Simulation of laparoscopic sacrocolpopexy using a Gynesim real tissue model by Bridget Joreitz, DNP, CRNP, Vrunda B. Desai, MD, and Mackenzie D. Errett, PAC. Laparoscopic sacrocolpopexy, otherwise known as LSC, is considered a gold standard for restorative apical prolapse repair. There are three common approaches to this procedure: open, laparoscopic, and robotic. However, laparoscopic and robotic sacrocolpopexy, or RSC, are more common and show equivalent anatomical results. LSC is technically more challenging for those who are not yet proficient in laparoscopy. However, it shows less postoperative pain, shorter hospital stays, and is associated with a lower cost. RSC is a good alternative to LSC for surgeons with good dexterity and precision. The learning curve is feasible without needing laparoscopic skills. However, with the robotic approach, there are longer operating times, increased postoperative pain, and higher cost. Training for LSC can be challenging due to accommodating for loss of depth perception, limited range of motion, and using long instruments. In 2008, ACOG developed a simulation working group to develop and validate standardized simulation-based curricula for residency programs. Simulation training can shorten operating time, increases intraoperative skills, and reduces risk of intraoperative and postoperative complications. There are two other models to train for LSC, including cadaver training and the Halstead model. Cadaver training has high rated satisfaction, but can be expensive and has ethical concerns. The Halstead model, also known as See One, Do One, Teach One, is insufficient, has long mentoring, is not cost-effective, and poses a higher risk to patients who are having surgery performed by inexperienced surgeons. The Gynesim real tissue model is a hand-constructed real surgical tissue model made from food-grade materials. It has customized pathology per request, which can include a large uterus, uterine fibroids, or ovarian cysts. It is USDA-inspected discard tissue and is ethically sourced. It needs clean handling, meaning it does not require special biodisposal, and it can be used in conference rooms, classrooms, office spaces, and labs. The Gynesim real tissue model is handmade from USDA discard tissue. It simulates key anatomy of the female pelvis, allowing the user to learn the critical steps of a laparoscopic sacrocolpopexy. Now what you see is the placement of a uterine manipulator with a sacrocolpopexy tip using a uterine positioning system. Anterior vaginal wall dissection is performed to separate the bladder from the vagina. Posterior vaginal wall dissection is then achieved to separate the rectum from the vagina. The anterior longitudinal ligament of the sacral promontory is identified and exposed. The Gynesim real tissue model enables practicing proper ergonomics throughout these steps. The learner can also work on determining proper sizing for mesh that is utilized. Afterwards, the mesh can be positioned on the posterior vaginal wall. As you can see, the model simulates limitations with range of motion and depth perception that often presents during laparoscopy. Sutures are then placed to fix mesh to the posterior vaginal wall. During this step, care is taken to avoid the rectum. Next, mesh can be placed and sutured to the anterior vaginal wall. Care is taken to avoid the bladder. Location for placement of mesh on the anterior longitudinal ligament of the sacral promontory is then determined. Next, the mesh is sutured to the sacrum. Learners can practice avoiding damaging surrounding structures, such as important vasculature, nerves, and structures like the ureter. Peritoneal closure is then achieved to cover the mesh. The Gynesim real tissue model is a high-fidelity training tool that facilitates the steep learning curve for laparoscopic sacrocolpopexy.